Hey all, hope you are doing well. I am Pratham Patil from KIT's College of Engineering, studying in Computer Science and Engineering branch. Today, I am come up with the most enthusiastic and future-oriented topic, which is nothing but the stem cell therapy. The stem cell therapy, the topic lies in the biotechnology as well. Okay, so stem cell therapy, which is nothing but the most trending topic in the biotechnological field. Most of the researchers and scientists perform their research on the stem cell therapy, how exactly it is, how performed, and what diseases cured by the stem cell therapy as well. So we will proceed with the to know regarding that topic. We will proceed with the 5 steps, which is nothing but the introduction, then stem cell therapy, what exactly it is. After that, the types of stem cells found in the human organism. After that, the diseases cured by the stem cell therapy. By using that therapy, we can cure much more difficult diseases as well. Okay, so and at the end, we will conclude with our conclusion. So first is the introduction about our topic. Research on the stem cells is advancing in future as well, and now is currently is also trending. So how an organism developed from a single cell? The stem cell therapy having one principle only, that entire organism developed from a single cell. This is nothing but the totipotency principle. The one cell having developed entire organism from that single cell. So how healthy cells replace damaged cells in the adult organism as well. The stem cell therapy having much more potential to replace the damaged cells in our body and taking their position as a new cell. Okay, and it promises the area of the scientists to investigate the possibility of cell-based therapy to disease cure much more difficult diseases as well. The stem cell therapy having a much more record in our biotechnological field, having that therapy cures much more difficult and hazardous diseases. After that, what exactly stem cell therapy? The stem cell therapy, it is nothing but, as I've told before, that is introduction of the new adult stem cells into a damaged tissue in order to treat disease or injury. Whatever the disease or injury takes place on the any organism like human and animals, these are the cured, and new adult stem cells are introduced in that organism to replace that damaged tissue with the new tissues. And the ability of that stem cells is to self-renew as well. The self regeneration of the cells takes place, and it takes place the position of the whatever the dead cells are there or damaged cells are there, they are getting position of that and cure that disease and cure that part as well. Okay, that can potentially replace diseases and damaged areas in the body with minimal risk of rejection and side effects. This is very useful and very healthy therapy to cure much more difficult and which is very safe therapy. After that, the stem cells. What are the stem cells? The stem cells can generate in those kinds of cells. The stem cell having potential to develop in the sex cell, muscle cell, fat cells, which is nothing but formed in the adipose tissue. Adipose tissue formed in our area of hips, thighs, and the bone cell. Bone cell found in the bone marrow cavity. In the bone marrow, the bone cells are formed, and stem cell having ability to develop in a bone cell as well. Okay, so after that, the blood cell is nothing but the RBC red blood cells, and the blood cells are also formed in the bone marrow cavity, and stem cell having ability to develop in that as well. After that, the nerve cell, nervous cells are found in the central nervous system, and whatever the nervous area of an organism, that central nervous system, and whatever the spinal cords are there, where the nervous cells are distinguished and various formed their network in our entire body. After that, the epithelial cells are formed in our tissues. And after that, the immune cells are done with the immunology of our body, and immune cells are nothing but the neutrophils. In that immune cells, which are much more types of cells are there also: neutrophils, eosinophils, basophils, lymphocytes are there, mast cells are there, monocytes are there, and B cells and T cells, which are dealing with our immune system of our body. Okay, so these are the cells which can stem cell can generate, which is nothing but the entire all the cells in our body can generate by the stem cell. So that's why the stem cell therapy is very useful and one much more scope in our future to cure the diseases which having no medicines and no any therapy for that. Okay, so next is the types of stem cells. found in our body. Other types of stem cells are nothing but the totipotent cells, pluripotent cells, and multipotent cells. Totipotent cells means each cell having ability to develop in the entire organism. Okay, these cells are found in human body in the cells of embryo of 1 to 3 days after fertilization of the male sperm and female egg. After the 1 to 3 days, the embryo generation takes place, and in that embryo generation, the totipotency principle is used by the cells for developing an entire organism from a single cell. After that, the pluripotent cell, each cell can form any type of cells of blastocyst. Like blastocyst is the stage of the embryo development. After the fertilization, the blastocyst formation takes place. The blastocyst formation is explained in the next slide as well, which having much more special structure in that, so we have to know about that. After that, the multipotent cells. Multipotent cell means the word defines that cells differentiate and can form a number of tissue types. Okay, so these are the tissues are nothing but the fetal tissue and blood, cord blood, and adult cells. Okay, so fetal tissue nothing but the tissue or cells obtained from a dead human embryo, and it is found in also induced abortion and stillbirth. The cells are found in that case as well. Adult cells are nothing but the undifferentiated cells found throughout the body, which is nothing but the somatic cells. Somatic cells means ki the cells present on the entire throughout the body, and these cells are continuously regenerating because the daily or throughout the life, the whatever the somatic cells are on our body is there. There is nothing but the outer skin of our body, and the continuously cells are dead and replaced by the new cell. Okay, so these are the nothing but the 3 types of stem cells, and in that 3 types, the entire body regeneration takes place. So next is the types of stem cells, which is nothing but the first type of stem cell is umbilical cord stem cells. Umbilical cord means at the time of delivery, cord blood is collected and stored, and after birth of the child, the whatever the umbilical cord is there, in that umbilical cord, the umbilical cord blood is collected and stored and frozen. These cells having in that blood, there is a stem cells are there. These stem cells having capability to regenerate or cure much more difficult diseases, which can affect to the human in future as well, and which has no cure and no medicines to cure within a few time or within a few weeks. Okay, so UCB contains 2 classes of stem cells. UCB, homeopathic stem cells, which is nothing but the HSC, and mesenchymal stem cells, MSC. These stem cells are used to cure the blood-related disorders such as the sickle cell anemia, thalassemia, and leukemia. Sickle cell anemia, which is nothing but the blood-related disorder. In that red blood cells are there. Whatever the RBCs are in our bodies are there. They are misshapen, or they are like sickle cell. They are like sickle shaped, and that this continuous breakdown of RBCs takes place in that disease. After that, the thalassemia. Thalassemia means this is the one of the inheritance disease, and leukemia. Leukemia is also the blood related disorders, which is nothing but the blood cancer. So next is the amniotic stem cell. The amniotic stem cells are they obtained from the amniotic fluid and amniotic membrane, which is developed into a various tissue. Amniotic stem cells are found in the whatever the fertilization of their sperm and eggs takes place. After that, whatever the generation of the embryo takes place, after that the amniotic fluid and amniotic membrane and formation takes place. For that, or collecting that stem cells by using the syringe or by using that therapy, we can collect the amniotic stem cells as well, and we can having much more potential to develop into the various types of tissue like skin, cartilage, cardiac types of tissue, nerves, and muscle and bone cells as well. Okay, so these amniotic stem cells are found after the fertilization, while developing the embryo take place, and after the embryo generation, whatever the body development takes place. After in that period, after formation of the embryo, these amniotic stem cells can be collected. For the formation, we can use the in vitro fertilization. By using in vitro fertilization technique, we can develop entire organism from that a single cell. So next is the embryonic stem cell. Embryonic stem cells means ES cells are derived from the cells in the inner cell mass of developing blastocyst. As I tell, the blastocyst is a stage of embryo development. So these ES cells are derived from the embryos that develop from the unused eggs that were fertilized in vitro fertilization clinic. As I tell, there is a technique of in vitro fertilization. In that unutilized or unused eggs are taken and there is a fertilization takes place. You know that a human cell ES cells are not derived from eggs fertilized in humans body. This is the stem cells are formed by using the unused eggs by using the in vitro fertilization technique. So these stem cells having potential to develop into an entire organism from a single stem cell. Okay. So the next, this is the nothing but the cell differentiation of the stem cell, in which the blastocyst formation shown in that figure as well. This is the in vitro fertilized egg, as it is the first. After that, the blastocyst stage in that, and after that the inner cell mass. Blastocyst stage is nothing but the group of cells in which the one of the group of this after fertilization of the embryo, fertilization of takes place, then embryo formation carried out, and in that embryo formation the continuous differentiation of the cells takes place, like by using the principle 2 raised to n. By using that principle 2 raised to 2 4, 4 raised to 216, and in that way the differentiation of the cells takes place. In that whatever the stage, one of the stage takes place is the blastocyst stage, in which the one of the group of the cells are concentrated toward the one of the end in that group of cells, and at other end the cavity is formed, which is nothing but known as the blastocele, and with the continuous circle of the cells are there. This is surrounded by the trophoblast layer, and the inner cell mass are concentrated at the one of the end, and the cavity is formed at the opposite end. This is nothing but the blastocyst formation, and this is the undifferentiated stem cells, and this inner cell mass, these are carried out as a stem cell, and these are the cultured in the undifferentiated stem cell. These inner cell mass cells are carried outside, and they are fertilized, and they are using for the in vitro fertilization technique. So the next are the adult stem cells. What are the adult stem cells in our body? The bone marrow stem cell first. After that, the peripheral blood stem cells, and neuron stem cells, which is related to the nervous system. After that, the muscle stem cells, which are found in the triceps, biceps, and whatever the muscles are takes place in our body. After that, the liver stem cells, pancreatic stem cells, which is found in the pancreas. After that, the renal stem cell. Renal means kidneys. These stem cells are found area towards the kidney. After that, the corneal limbal stem cells and dental pulp. After that, the allogenic. What are the allogenic stem cells? Allogenic stem cells means the stem cells taken out from the donor by carried out various stages of the donor. Stem cells are collected from the donor, and these stem cells are preserved by using the cryopreservation technique, and these collected stem cells are introduced in the patient by performing first therapy on that collected stem cells. After performing cryopreservation technique, the chemotherapy technique is also performed on that collection of the stem cells, and then infusion of the stem cells takes place in the patient's body. Okay, so this is the process in which the stem cells are connected from the donor and introduced into the patient's body, which is useful for that patient to cure any kind of disease and any kind of the damaged tissues in his body as well. Okay, so after that, the disease is cured by the stem cell therapies. First is Alzheimer's disease. Alzheimer's disease is a progressive disease that destroys a memory and other important mental function of our body. And after that is Parkinson's disease. Parkinson's disease is related to our CNS. This is nothing but the central nervous system that affects the movement and movement, often including the tremors as well. So Parkinson's disease related to our central nervous system. After that is spinal cord injury. Spinal cord injury in which the damage of the spinal cord and any of the nerves of that at the end of the spinal canal takes place. This is damage to the nerve in the spinal cords in that injury. Many more heart diseases also cured by that stem cell therapy. In a study published in the last February in the Lancet, the researchers treated the 17 heart attack patients with an infusion of the stem cells taken from their own heart. So this therapy having much more success in our future is guaranteed, and this therapy is widely used in world. So some of the diseases like CAD, coronary artery disease, hypertension. Hypertension means blood pressure. Cardiovascular diseases are also cured by that stem cell therapy. After that, the severe burns. Severe burns means the damage to the skin or deeper tissues by the sun or by the hot oil, hot liquids, fire and electricity. Whatever the horrible incidents are happened in our society, this in the fire, electricity damage and whatever the chemicals are thrown on their body, this causes much more damage of our entire skin, and this is also cured by the stem cell therapy as well. Okay, so the next, it is one of the historical fact in the stem cell therapy research, in that the patient, in that picture, the patient having the lower limbs were paralyzed after an incident in 1985, which damaged her lower back and hips. Afterwards, she spent her life in her bed. In 1985, this case has happened, that having the girl having the lower back and hips damaged after that accident, whatever accident takes place, and she is in continuously in a wheelchair after that incident. But the stem cell therapy, the stem cell transplantation, adult stem cells from his umbilical cord, which is collected during his birth, and these umbilical cord stem cells are used for their cure that accidental disease affect to that girl. And in just 3 weeks, by performing that stem cell transplantation in October 12, 2004, in just 3 weeks she started to walk with the help of the walker. So this is the historical fact in the research of the stem cell. And after that incident, the continuous research performed by the researchers to know more about the stem cell therapy. After that, at the end, shows the great promise for the regenerative medicine. It guaranteed it will cure the much more difficult and much more hazardous diseases which having no cure in future as well. This stem cell therapy can, and this stem cell therapy can generate a cure for that diseases as well, having no cure. After that, there is an enormous potential in human stem cell research as well. In both adult and embryonic stem cells should be studied, because these stem cells having much more potential to develop it into an entire organism. But in the totipotency principle is used. The one of the case you heard about that, the dolly ship is formed by the totipotency principle. By it is a copy of that female ship it is a female ship which is formed by the using the totipotency principle. That is nothing but it is developed from the single cell. Her lifespan is very low. I think she was lived for 3 to 4 months only. But this principle cannot use by the human, because it is banned in our society. That by using that technique we can form our exact replica, like exact replica of our body, exact replica of your body as well. So this is not allowed in our society to use that principle for the human generation. Okay, so this stem cell therapy used for the much more difficult diseases having no cure in the future as well. Okay, so after that, the much research needed before therapies are realized. Okay, so these are the major concerns in that therapy. After that, the ethical concerns can need to be taken into the account as well in that while performing the stem cell therapy, and the proper guidelines are followed are needed to ensure the appropriate conduct of the research in the stem cell therapy. So at the end, the stem cell therapy is very much essential in future, and it guarantees that it will cure much more difficult diseases and makes our society much more healthier. Promise to cure many hazardous diseases. This therapy can help to find solutions and find cure on that. So thank you so much for watching my video. Like my video, share and comment. Thank you so much.